We are Group I. We were presented with a sheep case. Please see the students that participated in the making of this presentation. Presented with a white ovine meatmaster of 5.5 months old. It was a female with a body condition score of 1, which received from Essie de Klerk boerdery situated in Brits. We had a case history where the presenting complaint was a submandibular edema, in layman's terms known as bottle jaw. We also had a severe anemia, which was represented in all the mucous membranes. And also there was a treatment history of fluconazole and Provexia, which is both antiparasitic drugs.
We will now take a look at the different NDs. So firstly, we saw that it had severe diffuse subcutaneous edema. We also saw severe anemia in the mucous membranes of the eye, the mouth, and the vulva. Mild hydroperitoneum and mild hydrothorax was also observed. Then we had severe diffuse pulmonary congestion and edema. Severe serous atrophy was also observed. This serous atrophy was seen in the coronary groove of the heart, in the bone marrow, and as well in the renal pelvis. A very significant finding in our PM was that she had severe ruminal hypoplasia with chronic diffuse ruminal papillary hypoplasia. Severe chronic diffuse hepatic atrophy was also observed. The following incidental findings were seen. As we will discuss later in this presentation, due to the malnutrition, we could see that she had signs indicating pica. So we saw sand in the small intestine, and then a plastic bag in the rumen was also found. Moderate, locally extensive cerebral melanosis was observed. This connective tissue was seen on the capsular surface of the lung on the dorsal aspect. Post-mortem findings included hypostasis of the lungs,
Our main lesion was congested lungs, and this is due to acute heart failure, which we determined to be our cause of death. The animal was in a severe cachexic state, with serious atrophy of fat stores in the bone marrow, coronary groove of the heart, and renal pelvis. The animal had a severe protein energy malnutrition due to chronic malnutrition and malabsorption, as well as a homunculus burden. This led to insufficient energy to maintain body temperature at night, leading to hypothermia, causing acute heart failure. The sheep also had widespread edema, with hydrothorax, hydroperitoneum, and anasarca. This was due to hyperproteinemia caused by the malnutrition and malabsorption, as well as the homunculus burden. This led to decreased oncotic pressure and transudate leaking from the vascular system into adjacent tissues. The anemia evident with pale mucous membranes and watery blood we determined to be a chronic regenerative anemia with hyperplasia of the bone marrow as well as polychromasia evident on the blood smear. This was due to a homunculus burden.
Our DD list consists of primary and secondary cachexia. Protein energy malnutrition is a syndrome that arises due to insufficient feed, high roughage low concentrate diet, poor rumen microbial activity, and hyperplasia of rumen papillae.
Second on our DD list is secondary cachexia. Secondary cachexia can be caused by Homunculus contortus. No worms were found on post-mortem. However, 5 eggs were seen on microscopy. Another cause of secondary cachexia can be dental disease, which is caused by excessive attrition, which leads to a decreased feed intake. The suspected cause of death was depleted energy reserves due to protein energy malnutrition. PEM impairs the animal's ability to maintain its body temperature, especially during low ambient temperatures. Death occurred due to acute heart failure, secondary to hypothermia.
Sampling and specimen collection. The first thing we did was to make a blood smear to rule out the possibility of anthrax. On the blood smear, a mild hypochromasia was seen as a more pronounced central pallor of the red blood cells. This could have been due to an iron deficiency. There was, however, signs of regeneration seen. There was anisocytosis as well as immature red blood cells present. A brain smear was made to rule out the possibility of heart water. This, however, showed no significant findings. On a fecal float, we saw a few stronger lid type eggs. This was probably the last few resident eggs after the deworming of this sheep. We examined a drop of rumen fluid on the slide with a cover slip under the microscope. A monopopulation of microbes was seen, signifying rumen dysbiosis. Sampling for histology. We sampled all the major parenchymatous organs, including the brain, rumen, reticulum, abomasum, and duodenum. We used a sharp knife to take the samples of less than 1 by 1 by 1 centimeters. The samples was placed in a labeled jar containing 10% buffered formalin. We made sure not to exceed the formalin to tissue ratio. The samples were sent to the pathology department of the Faculty of Veterinary Science, UP. The histological findings confirmed our macroscopical observations. In addition, large numbers of neutrophils were seen within the vasculature of the lung, splenic red pulp, and liver. Severe pancreatic atrophy was also seen.
Advice that we would give this farmer includes the following. Nutrition-wise, small amounts of creep feeding, even before weaning, assure proper ruminal development. High-quality feed for ewes ensures adequate milk, which also stimulates the rumen. After weaning, energy is very important. This can be in the form of mealies. Even a small amount in the case of financial restrictions may be helpful. Once rumen development is negatively influenced, it cannot be corrected and these animals need to be culled. When it comes to deworming, lambs can be dewormed against tapeworms from 2 months of age. Vaccination against pulpy kidney is necessary before deworming is done. Deworming against roundworms can be done at weaning if necessary.
In conclusion, in this case, multiple factors may have played a role. The underdeveloped rumen would not have allowed for adequate absorption of nutrients, and the history of lucerne feed would not have provided enough energy for this animal to maintain its body temperature. Herd dynamics may also have played a role in feed axis for this animal. No lesions pertaining to a primary infectious etiology were observed.